Health, senior, elderly, aging, stroke prevention, brain health. These are not just medical terms. These are life-saving realities. Do you know that your body often gives early warning signs of stroke almost a week before it actually happens? Seniors, elderly individuals, and even adults over 30 must pay attention because ignoring these signs can mean the difference between life and death. So today, as your health guide, I will break down 10 early signs of stroke that you might notice too late. I'll explain every symptom, why it happens, what foods and habits make it worse, what lifestyle can prevent it, and even home remedies that can support brain and artery health. And don't forget, drop your questions in the comment section below, because your comment can help another person learn and save their life. Q1. What is a stroke and why is it so dangerous? Answer, doctor style. A stroke happens when blood supply to a part of the brain is interrupted, either because of a clot, ischemic stroke, 87% of cases, or because a blood vessel bursts, hemorrhagic stroke. Without oxygen, brain cells start dying within minutes. Stroke is the 5th leading cause of death in the USA and a major cause of disability in seniors. The shocking fact is, almost 1 in 4 people who get a stroke had early warning signs days or weeks before. That's why we must learn to recognize these signs early. 10 early signs of stroke, 1 week before. Sign 1. Sudden severe headache, sentinel headache. Research shows that sentinel headaches can occur days before a major stroke. It feels different from normal headaches, more intense, sharp, and sometimes localized on one side. It may come with nausea or vision problems. Why it happens? Because small blood vessels in the brain may already be leaking or a clot is temporarily blocking flow. Solution. What to do? Never ignore a new or unusual headache, especially if you're above 40. Check your blood pressure immediately. Consult a doctor if pain is persistent or combined with dizziness or blurred vision. Sign 2. Sudden dizziness or loss of balance. Seniors often think dizziness, weakness or dehydration, but in reality, stroke-related dizziness is unique. You feel like the room is spinning, or you suddenly cannot walk straight. Why it happens? Because arteries supplying the cerebellum, balance center of brain, are blocked. Solution: home remedies. Stay hydrated, avoid sudden standing movements. But if dizziness happens suddenly and intensely, call 911 immediately. It's not dehydration, it may be a stroke precursor. Sign 3. Numbness or tingling in face, arm or leg, especially one side. This is a classic early sign. You may feel sudden weakness, heaviness, or pins and needles sensation in your arm or face. Why it happens? Because tiny clots temporarily reduce oxygen flow to the nerves controlling muscles. Doctor tip: if your smile suddenly looks uneven in the mirror, or you cannot raise one arm properly, don't wait. Go to emergency. Remember the acronym: FAST. Face drooping, arm weakness, speech difficulty, time to call 911. Sign 4. Blurred vision or sudden loss of vision, one or both eyes. Vision changes are a big red flag. Some people describe it like a curtain coming down over one eye. Why it happens? Because the blood flow to the optic nerve and visual cortex is compromised. Foods that support eye and brain circulation. Omega-3 fatty acids, salmon, flax seeds, walnuts, dark leafy greens, spinach, kale, carrots and sweet potatoes, beta-carotene, foods that worsen. Risk: excess sugar damages blood vessels, trans fats, fried food, margarine, high sodium processed food. Have you or someone in your family ever experienced sudden headaches, dizziness or numbness? Share your story in the comments. Your experience may save someone's life. Sign 5. Slurred speech or trouble finding words, aphasia. What it looks like. You know what you want to say, but the words come out garbled, slow, or you use the wrong words. Others may notice your speech sounds drunk or you're mixing words. Why it happens: a brief blockage in the artery feeding your brain's language centers, usually left hemisphere, can disrupt word formation or understanding. What to do now? Time the onset, note exact clock time, and call 911. Do not take aspirin unless an emergency professional instructs you. Some strokes are caused by bleeding. If symptoms clear in 1 hour, it might be a TIA, still a medical emergency and one of the strongest predictors of a future stroke. Sign 6. One-sided facial droop, uneven smile. What it looks like: you try to smile and one corner of the mouth doesn't T-lift. You may drool or feel numbness on one cheek. Why it happens: a clot affecting the facial nerve control area in the brain causes weakness on one side. Home check. Stand in front of a mirror and say E. Watch for symmetry. Ask a family member to look if you're unsure. Action. Call 911 immediately. Facial droop plus slurred speech plus weak arm is the classic fast combo. Sign 7. Sudden confusion, memory gaps, or trouble understanding what it looks like. You suddenly can't follow a conversation, can't understand simple instructions, or feel mentally foggy in a way that's not normal for you. Why it happens: transient reduction in blood flow to language, attention, processing areas of the brain. Different from normal aging. This comes on suddenly and is noticeably different from your usual baseline. Action. Note the exact time and call 911, even if it fades. Sign 8. Sudden hearing changes or ringing, often one ear. What it looks like: rapid hearing loss in one ear, new intense ringing, tinnitus, or feeling like sounds are muffled or far away. Why it happens: vascular issues in the inner ear or brainstem circulation can present with sudden sensorineural hearing loss. It's uncommon, but important. Action. New, sudden hearing loss. Urgent evaluation. Do not wait. Sign 9. Clumsiness, dropping objects, or trouble with coordination, ataxia. What it looks like: you can't button a shirt, keep dropping your keys, or your hand feels not yours. Legs may feel wobbly, you veer to one side when walking. Why it happens: inadequate blood flow to the cerebellum or motor pathways. Home check. Close your eyes, touch your nose with each index finger. Run your heel down the opposite shin. If it's suddenly hard to do, call 911. Sign 10. TIA episodes. Symptoms come and go in 1 hour. What it looks like: any of the above. Weakness, speech trouble, vision loss, dizziness that resolves quickly. Why it matters: a TIA is a mini stroke and a major warning. Risk of a full stroke is highest in the next 48 hours. Action. Treat a TIA as a true emergency. Go now, even if you feel back to normal. Doctor-designed stroke prevention diet, senior-friendly USA. Think Mediterranean-hybrid. Plants first, fish, legumes for protein, low sodium, high fiber, healthy fats, stable blood sugars. The big rules. Easy to remember. 1. Half your plate and vegetables and fruit. Aim 5+ servings day. 2. 1/4 handose lean protein, fish, beans, lentils, tofu, skinless poultry. 3. 1/4 nash whole grains, oats, brown rice, quinoa, whole wheat pasta. 4. Healthy fats daily, extra virgin olive oil, nuts, seeds, avocado. 5. Sodium, Sasabword 500, 2,000 billion a day. Ask your doctor if you have kidney heart issues. 6. Added sugar, keep it low. Skip sugary drinks. 7. Fiber, 25-30 GD a day. Helps cholesterol, blood pressure, blood sugar. If you have kidney disease or are on potassium-sparing meds, discuss fruit-veg potassium targets with your clinician. Eat more of these: brain and artery support. Leafy greens, spinach, kale, collards, broccoli, Brussels sprouts, berries, blueberries, strawberries, citrus, pomegranate, apples, whole grains, oats, barley, brown rice, quinoa. legumes, lentils, chickpeas, black beans. Fish, salmon, sardines, trout, 1 to 2 texts week for omega-3s, nuts and seeds, walnuts, almonds, flaxseed, chia. Olive oil as primary cooking fat. Low-fat dairy or fortified alternatives if tolerated. Limit or avoid these. Processed meats, bacon, sausage, deli meats, fried fast foods, and anything with trans fats, partially hydrogenated oils. Excess salt. Canned soups, frozen entrees, salty snacks, restaurant sauces. Refined carbs and sugars, pastries, white bread, sugary cereal, soda. Heavy alcohol, max. 1 drink day for women, 2 for men, or less if advised. Licorice can raise blood pressure. Simple, senior-friendly meal plan. Example day, breakfast. Oatmeal cooked with cinnamon, topped with blueberries and walnuts. Green tea or black coffee, easy on cream sugar. Lunch, big salad, spinach plus tomatoes, plus cucumbers, plus beans plus avocado. Olive oil plus lemon dressing, whole grain toast. Snack, apple, plus 1 TBSP peanut or almond butter, or plain yogurt with ground flaxseed. Dinner, baked salmon or lentil loaf. Roasted broccoli and carrots. Quinoa with a drizzle of olive oil. Evening, chamomile tea. If hungry, a few almonds or a small kiwi. Practical home remedies and daily habits, safe, evidence-aligned. These support heart-brain health. They are not a treatment for active stroke symptoms. 1. Blood pressure routine, morning ritual. Sit quietly 5 minutes, feet flat, arm at heart level. Take 2 readings 1 minute apart. Record the average. Target is individualized. Ask your doctor. Many seniors aim for 130/80 if safe. Share your log at each visit. 2. The salt swap habit. Replace salt with herbs, spices, garlic, onion powder, paprika, rosemary, thyme, oregano, black pepper, lemon juice, vinegar. Buy low sodium or no salt added versions. Rinse canned beans, veggies. 3. Hydration rule. Aim for clear to pale yellow urine. Sip water across the day. If you have heart or kidney failure, follow your clinician's fluid plan. 4. Pulse check. AFib screening at home. Once daily, feel your pulse at the wrist or neck for 30 seconds. If it's irregular, skips or uneven, or too fast, slow, call your doctor. Atrial fibrillation raises stroke risk. 5. Movement snacks for desk or TV time. Every 30-45 minutes, stand up for 2 to 3 minutes, walk, march in place, or do heel-to-toe rolls. Add a 20-30 minute walk on most days. 6. Sleep and snoring. Check. Loud snoring, choking at night, or daytime sleepiness. Ask about sleep apnea. Treating it lowers stroke risk. Keep a consistent bedtime and cool, dark bedroom. 7. Stress down minutes. For 7 to 8 breathing. Inhale 4, hold 7, exhale 8 for 2 to 5 minutes twice daily. Try prayer, meditation, or calming music. Daily consistency beats intensity. 8. Supplements. Use caution. Fish oil omega-3 may help triglycerides, can interact with blood thinners. Turmeric curcumin is anti-inflammatory, but may affect bleeding risk. Ginkgo can increase bleeding risk. Avoid if on anticoagulants. Always ask your doctor/pharmacist before starting anything new. 9. Smoking and alcohol. Quit smoking, ask for nicotine replacement plus counseling, success rates triple. Alcohol. Less is more. Many seniors do best with none. 10. Emergency readiness. Keep a meds list, allergies, and an ice contact on your phone and on the fridge. Tell me in the comments. Which sign surprised you the most? Speech trouble, hearing changes, or sudden clumsiness? Also, would you like a 7-day stroke smart meal plan plus grocery list in the next video? Your comment helps this reach more seniors who need it. We've explored the early signs and diet. Now let's put it all together. Imagine having a doctor-approved weekly plan that covers your food, movement, sleep, stress, and medication safety. This is your A to Z guide to aging with energy and protecting your brain. Weekly stroke-safe planner, sample. Designed for seniors but adaptable for ages 30-60. Always check with your physician before starting new diet, exercise. Monday, Friday. Routine, morning, 7 to 9 a.m. Warm water, plus lemon garlic, 15-30-minute brisk walk or light yoga breakfast. Oats, plus berries, plus walnuts, midday, 12 to 1 p.m. Lunch, leafy salad, plus beans, fish, plus olive oil dressing, 5-minute deep breathing before or after meal. Afternoon, 3 to 4 p.m. Herbal tea, ginger, turmeric, 2 to 3. Stretch or walk movement snack. Evening, 6-7 p.m. Strength or balance training, light weights, resistance bands. Dinner, vegetable stew plus quinoa plus steamed broccoli night, 9-10 p.m. Screen-free wind-down chamomile tea, turmeric milk, gratitude journaling or prayer, reduces stress and BP weekend routine, one longer nature walk or swimming if possible, try a new healthy recipe with family social connection, call a friend, attend community activity, lowers loneliness and stroke risk. Exercise plan. Safe for seniors and midlife adults. Even 20 minutes of daily movement cuts stroke risk by nearly half. American Heart Association. Core plan. Walking. 30-minute brisk walk. 5 days week strength training. 2x week. 15-20 min. Light weights, resistance bands, or bodyweight squats and wall push-ups. Balance and flexibility. 10-15 min daily. Yoga, Tai Chi, simple stretches. Breathing exercises, 5 min day, deep belly breathing, 4 to 7, 8 method. Tips, wear supportive shoes, avoid slippery surfaces, warm up 5 minutes, cool down 5 minutes, stop if chest pain, severe dizziness, or sudden shortness of breath. Sleep plan for brain health. Target 7 to 8 hours night for adults, 7-9 hours for seniors. Consistency, same bedtime and wake time daily. Environment. Cool, dark, quiet room. Limit screens 1 HR before bed. If snoring loudly or gasping, get checked for sleep apnea. Treating it lowers stroke risk. Sleep. Tip, a small kiwi or chamomile tea, 1 HR before bed improves natural sleep. Stress relief. Blueprint chronic stress raises BP and blood sugar, silently damaging arteries. Daily calm routine, 10 min 3 min deep breathing, 5 min meditation, prayer or gratitude, 2 min gentle stretching. Nature time, at least 2x week, walk outdoors. Music therapy, 10-15 min of calming music reduces stress hormones. Medication and medical checklist, doctor guidance. Only take medication as prescribed. Always consult your doctor before changes. 1. Blood pressure meds. ACE inhibitors, ARBs, beta blockers. Take at same time daily, never skip suddenly, can spike BP. 2. Cholesterol meds, statins. Take in evening, most effective for many types. Report muscle pain to doctor. 3. Diabetes control. Check fasting sugar or A1C as recommended. Stable blood sugar, less vessel damage. 4. Blood thinners, aspirin, warfarin, DOACs. Take exactly as directed. Avoid high-dose turmeric, ginkgo, or fish oil without approval. Report any unusual bruising or bleeding. Doctor visits. Annual physical BP check every visit. Cholesterol and sugar labs every 6 to 12 months. Hearing and vision check every 1 to 2 years. Remember, stroke is not an inevitable part of aging. Your arteries respond to every choice you make. What you eat, how you move, how you rest, how you manage stress. Think of this blueprint as your daily insurance policy for brain health. Even small steps, adding a daily walk, swapping salt for herbs, or choosing water over soda, can cut your risk dramatically. You have the power to protect your memory, mobility, and independence. Age is just a number. Health is a lifestyle. Tell me below, which part of this lifestyle blueprint do you want me to expand into a full step-by-step video? Diet, exercise, sleep, or stress plan? Your comment can help another senior discover this life-saving information, and always consult your healthcare provider for personal medical decisions.